Hi, everybody. This is Dr. Shahin Ghadir. I am one of the physicians at Southern California Reproductive Center, and I am very proud to be presenting today a presentation on family planning for all. It is very important here for us at Southern California Reproductive Center to be inclusive of all of the populations that we cater to, and for everyone who wants to have a baby, give them the equal opportunity to have a beautiful family. So I appreciate everyone joining today. I'll give an opportunity at the end to do questions and answers on my part, and just bear with me because it's a little awkward just talking to a screen, but I'm here and more than excited to get started. I hope everyone can hear me well, and I don't know where I will see a comment for anyone that cannot, but I think that it's going to be fine. So thank you again for joining us, and I'm going to go ahead and go to our next slide. So Southern California Reproductive Center has been around for quite a while. My two senior partners who started this practice over 25 years ago did an excellent job. I've been here for 18 years. We have been consistently rated as one of the top 10 fertility centers in the United States. I think #1 on the West Coast of the United States. And we have one of the most state-of-the-art advanced embryology labs in the country. So what that means is that the science of what happens in our laboratory is one of the most advanced available to us in this day and age and in the United States. And since the United States is at the forefront of fertility, we like to think that our clinic is one of the top with some of the best science in the world. We do have our own on-site surgery center. As I said, the technologies that occur in the IVF lab are some of the newest available in the entire world. We do have also all of the services for testing sperm, which is called the andrology department, and also the endocrine department, which does all of the blood tests available in-house. The building that you're looking at, our clinic is the entire 5th floor. I am the corner right there underneath the Roxbury sign on the 5th floor. Those are my 2 windows on one side and 2 on the other. And our surgery center and IVF lab are on the other side of the building, but the entire 5th floor. Coming in from where that tree is on the entrance is the main side of the building, and we have also 90% of the 1st floor, which is the picture that you see walking into that white lobby area. And that's where all of our blood tests, and that's where all of our ultrasounds, and also all of our sperm testing is done. So with that being said, and now having an understanding of where we are in the heart of Beverly Hills, I will proceed to the next slide. So as I told everyone, I am one of the physicians. I'm a founding partner here at Southern California Reproductive Center. I was a fellowship trained physician in both at the UCLA and Cedars-Sinai Medical Centers, and that's how I started to get to know this practice, and that's how I've ended up here now for the last 18 years, and very happy and proud to be here. So we are very proud because we have put 3 different companies together. Our IVF lab is called the ART Reproductive Center. Our surgery center is called the Roxbury Surgery Center. And Southern California Reproductive Center is known to be one of the top clinics in the country. So we put a holistic approach together that tries to put everything which involves science and empathy and care and inclusiveness for our populations all together here. And this is what gives us one of the state-of-the-art best labs and surgery centers in the country. On the right-hand side, you see lots of science that occurs in our lab on a regular basis. One of the most important things about our lab that makes it amazing is our lab director is extremely experienced, came to us from one of the largest programs in New York City. He's a certified lab director. He's a PhD in embryology. Every single thing that we do in our lab is double witness verification process. And what that means is your egg and sperm are never, ever left alone in an area with someone else's sperm or egg. And every single time it is assessed, there are 2 people around to double check and make sure that nothing is being moved around. And we limit the chance of anything being mixed up in this way and with this science and this protocol that we have together. Blastocyst cultures involve us allowing the embryo to be grown to day 5, 6, or 7, which is the full-grown embryo. It's called the blastocyst. And that is one of the techniques that's done with the best labs in the country, where you let the embryo grow all the way before it needs to be placed inside of a uterus, whether it's the intended mother or whether it's inside of a surrogate. Vitrification is the most advanced version of freezing. So it's called flash freezing, and that's the technique where we use for freezing eggs and also embryos in the fastest way possible, which gives us the most successful recovery and thawing process in the future. One of the other very important things that we're able to do is once an embryo grows to the full-grown stage called the blastocyst, we are able to do a tiny little biopsy of the blastocyst, which then allows us to do what's called PGT, pre-implantation genetic testing. So what that means to you is that once we put egg and sperm together and an embryo grows, we are able to genetically test the embryo and make sure that it is completely healthy by removing a couple cells from the embryo and then knowing that that embryo is healthy before it goes back into a surrogate or into the uterus of the patient. So we will be checking for all 46 chromosomes. As a result, the X and the Y chromosome are also revealed, and if someone cares, we are able to tell them if their embryos are male and female, and if they have both embryos, they're able to choose the gender that they want to go back into the uterus. So we're able to actually allow people to select the embryo that they want to go back in terms of the gender that goes into the uterus. With that being said, that is also the technique we use to do gender selection and gender selection and pick the gender. So the gender of the embryo is allowed to be determined before and picked if you're lucky enough to have both genders. And also, one of the most advanced things we have in the IVF lab is our time-lapse video analysis incubator, which is called an EMBRYOscope. It allows an embryo to stay in the incubator for the entire 5 to 7 days of growth without ever having to be moved, exposed to air, exposed to light, and it has been proven to give us a higher chance of success and a better quality embryo by the embryo growing in the EMBRYOscope. There are very few clinics in the entire country that have EMBRYOscopes. We're very fortunate to have 2 of them here in our clinic, and they're available for our patients to use who want to use it. And it does take also 1,000 pictures a day, so our embryologists can analyze and see how beautifully the embryo is dividing and which embryos divide nicer than others, and give us more diagnostic feedback on which ones we think are going to implant the best as well. So family planning is an important thing, and we really wanted to do this during June, which is Pride Month, and celebrate everything we've done for so many patients in the past, and also the fact that SCRC is committed to equality and reproductive services for all LGBT families. This is important for us, and that's why this presentation is happening now, and that's why we have helped so many hundreds of LGBT families in the past get to their goal of having beautiful families. So what are someone's personal fertility options? They vary a lot. We have single men, single women, we have male couples, we have female couples that all come in. When looking at the couple that are 2 men coming in, we have, for our gay couples, the ideal situation of how to do this is to go through egg donation with an anonymous donor or someone that you bring with you, but most people are bringing an anonymous donor that we help them select. Give us those eggs through what's called egg donation, and then those eggs are going to be implanted and injected with sperm. Generally speaking, both male partners, we use both of their sperm and usually divide the eggs in half. So if, for example, we are able to get 20 eggs out of an egg donor, 10 go to one partner and 10 go to the other. But we have done many different scenarios of this where one partner didn't want to partake or it was a single male, and we can make that and customize it to exactly your own personal family needs or personal needs in terms of how many eggs get injected with whose sperm. And once the embryos are created, we will always know which embryo belongs to which father. And at that time, we can decide if we're going to just put one embryo back from one parent or 2 embryos from the same parent, or we have the capability of putting one embryo from each father back into the surrogate, which is also a rather common way to do so, because it is rather challenging to find an excellent surrogate, and many people choose not to go through this process multiple times. But with that being said, I think that area has grown, and many people are also realizing that there are risks involved with having twins, and putting one embryo back at a time could be potentially safer. So that is one route of trying to do this. We also, for our female lesbian couples, we are able to do multiple different things. So one is we can take donor sperm and artificially inseminate the person who is trying to get pregnant. It's called a therapeutic donor insemination, or an IUI with donor sperm. Or there is something else that we have done many times before, where we're able to do the IVF process by taking the eggs out of one or both of the females. And we can also do what's called reciprocal IVF, where we can take the egg and the sperm and the egg from one female, make an embryo, and implant it into the partner so she can be the gestational mother or carrier. And that's called reciprocal IVF. Again, we have multiple ways of doing this for our female same-sex couples, because we can do IUI with the donor sperm, or we can do it with the IVF, or we can transplant from one person into the other for reciprocal IVF. So we spoke about this a little bit right now, but just a little bit more detail. How do we get donor sperm? So there's basically two ways of doing so. One is through an anonymous sperm bank, or one is through a known sperm donor, okay? When we do the known sperm donor, we require the family to also have legal documents with the known donor, and there's a good amount of testing that the FDA requires us to do on the known sperm donor before that sperm can be done and used for making either artificial insemination or the IVF or reciprocal IVF. When looking at the artificial insemination or the therapeutic donor insemination with anonymous donor sperm, all of that stuff has been done before, so legal contracts are not necessary. FDA testing has already been done and not necessary as well. And it says, how do we choose which partner carries the baby? It is a very, very personal decision on how the couple wants to do it. I have couples that say they both want to carry. I have couples that say one of the partners absolutely will never carry. I've even had lesbian couples that got a surrogate because neither of them wanted to or could not carry the pregnancy as well. It also says, how can we ensure that the baby has a biological relationship with both partners? And in many conditions, reciprocal IVF, where we take the egg out of one partner, fertilize it with donor sperm, and then implant it into the other partner, is something that we do, and that's why I find reciprocal IVF to be such a beautiful process. So for our gay couples, what exactly do we do? It says, what are my options for using a surrogate? We have someone in-house that helps people find surrogates. She is our third-party concierge, and she basically will speak to the couple and see exactly what it is that they're looking to do in terms of their goals and what kind of a surrogate, and then start doing a search for that person, okay? That's how we help you find the surrogate. Once you've selected a surrogate, you will come in. The surrogate will come in and do certain FDA testing. It is extensive. It checks for a drug screen. It checks for other abnormalities. When we're looking on how to get the donor egg, we can also help that process, but there are lots of agencies where you can get eggs. SCRC has our own exclusive egg donor agency that we use to help people find eggs, and if we're able to find you someone from that group, it's wonderful, and we're happy to help that way. We will make sure that the egg donor has genetic testing done, and also the fathers have genetic testing, so there is no overlap of a disorder that both the female and the male donors of sperm and egg have, because that could be a dangerous situation. It also says, how can we ensure that the baby has a biological relationship with both partners? Well, the way that this is done is that we use sperm from one partner, and we have to use a surrogate. There is absolutely no way to put two sperm into one egg. It is not capable of being done right now, but that is biologically the best way that we can do that at this time. As I said, the legal aspects of this process can be a little daunting and a little bit more cumbersome than expected, but it is purely for the safety of our couples to never have any issues later on. The legal contract will be required by each party having their own attorney, and the surrogate has an attorney, and so does the couple. Agreements include the rights of parents and carriers, compensation that occurs towards the surrogate, also ongoing contact expectations post-birth, it could all be documented there. So if you don't want any contact after delivery, it's all there. If you do, it's all there. And also the decision about how to get the best medical insurance for the surrogate as well is going to be decided upon as well. So how does IVF work? IVF, in vitro fertilization, is the process of fertilizing the egg and the sperm outside of the body. The word in vitro means outside of the body, fertilization. We always begin with a patient evaluation that looks at multiple different things. We always start with a medical history for all of our female and male patients. Physical exams will occur as well when indicated, and diagnostic testing happens for everyone involved in this process as well. For the female, one of the most important tests that we do is a blood test called AMH. AMH is the anti-Müllerian hormone. The higher the AMH level, the more eggs a female has. We want this number to be good, solid, high level, especially for gay couples using both of the sperm, because it has to be divided into two. And this is also the first assessment we do on any of our female couples coming in, deciding on who should be donating their egg first, or if anyone has a good chance or better chance than the other person. Ultrasounds looking at the ovary and looking at those little bubbles, which are future housings of eggs, called antral follicle counts, can also be very helpful and let us know if an ovary looks young or looks old. When we are in utero, we have the largest number of eggs in the female ovary, which is in the millions. At birth, this number drops to about 2 million, and by puberty and the first menstrual cycle, it has already dropped to 400,000. So what happens every month with ovulation, not only one egg is released and ovulated, but it's actually one is ovulated and about 1,000 die off during that process. And that's why these 400,000 eggs die off so quickly by menopause. And one more important thing that happens with that decline and as age goes on is not only does the egg count go down, but also the well-being and the genetic normal eggs start to go downhill as well. So as a female ages, the quantity and quality of her eggs both decrease, and that's why delayed reproduction makes it very difficult to get pregnant. That's why when people are selecting egg donors for our gay couples, we really encourage the egg donor to be between the age of 20 and 29, which is the peak ages for someone in terms of their egg numbers. The male testing is rather straightforward. We start off with a sperm analysis that checks the volume to make sure that it's more than 2 milliliters, the sperm count, looking to make sure that the sperm is more than 20 million per milliliter. That's called concentration. And the motility, we like it to be over 50%, and that means 50% of the sperm swimming well and swimming fast. And the morphology, which means the normal look of the sperm. When looking at morphology, we do look to see that a sperm has a normal neck, also a head, and a normal tail. Only 14% need to be normal to be considered a very normal semen analysis, because unfortunately, since there are millions of sperm, it is very inaccurate to say that the majority has to be normal to be considered normal. Excuse me. So there are different modalities to get people pregnant. The number one way that gives you the highest success rate is in vitro fertilization. This slide is actually a little bit older because our success rates have now hit close to 80%. But we also can start with a natural cycle, which means no medications are given. At the right time of ovulation, sperm can be taken, whether donor sperm or regular sperm, from a known person or a donor, and injected inside, and that's the natural cycle with artificial insemination. The cycles in the middle can also involve clomiphene, which is also known as Clomid, or injectable medications that help people ovulate a little bit better. But ultimately, the in vitro fertilization process, which makes embryos that allows us to genetically test the embryos, gives us the best outcome. when doing an in vitro fertilization cycle, what we wind up doing is giving injections to the person producing the egg. So if it's the intended mom making her own eggs or an egg donor, injections are given about 10 to 12 days into the stomach, and during that time, the normal ovary with those little bubbles begins to have medium-sized bubbles and then starts to have big bubbles, and those bubbles are called follicles. Once the follicles have grown, you can see in the bottom right-hand picture, there is a needle going into that bubble. That is the process of an egg retrieval that occurs in our surgery center, takes about 5 minutes under a light sedation that allows us to capture all of our eggs. Once the eggs come out, the egg and the sperm are put together and they make a fertilized egg called an embryo. And then the embryo keeps dividing from 2 to 4 to 6 to 8, 16. And once we can't count anymore, and there's a few hundred different cells, we get to what's called the blastocyst stage, which is the full-grown stage. At that point, we can take a couple cells from the backside of the embryo, and those cells will go out for pre-implantation genetic testing. And with a successful genetically normal embryos, our success rates have now hit between 76 and 84%. And again, I'm sorry, the slide is a little bit outdated, but our success rates are around 80%. Embryo development also can be done in the incubator that's called the embryoscope. It watches every single division of the embryo. And as you can see, we went from 1 to 4 to 2 to 4 to 8 cells. And this is called the embryoscope. It is time-lapse photography of the embryo in the incubator growing completely and beautifully to get to this blastocyst stage, and gives us a lot of information about the well-being of an embryo that divided well. So in that little process, we're basically able to see which embryos divided better than the others, and the embryo never needed to be disturbed for the 5 to 7 days of growth, and that has been proven to give a higher chance of embryo quality and pregnancy rate. Okay, so IVF success with genetic testing is an important process for us to do. It is pretty much consistent, and this is showing us that whether you're under 35 or in your 40s, the blue lines and the blue bars are pretty close to each other. So what it means is that as long as you're able to make one genetically normal embryo, whether you are in your 40s or younger, the success rate is very similar, and similar between the 70 and 80 percentile. So genetic testing allows us to weed out the embryos that are not doing so well and allow us to do really, really well with putting a genetically normal pre-tested embryo back into the uterus. So what do you do when you want to start your fertility journey? The thing is that we can help. So you're going to reach out to one of us. I'm Dr. Shahin Ghadir. These are my partners that all work at my clinic. And we will set up a consultation where we will go through every single thing that is pertinent to your particular case in terms of if it's a gay couple or a lesbian couple or a single individual moving forward. And also, if someone is not ready, we can also help them preserve their fertility for the future as well. Once we do an IVF cycle and we have extra embryos left over, those embryos are used for the future as well, for future kids and siblings. We are very proud that at SCRC, we've had over 20,000 babies born and millions of memories as well. Again, I'm Dr. Shahin Ghadir, and I'm more than happy to answer any of your questions. And I really thank all of you for joining us today and taking your time to learn and become more proactive about your fertility. So at this point, I'm going to go ahead and let me see if there are any. If you would like to go ahead and type your questions in, you could put it into the Q&A. And I do see that there are some things already going on in the chat section. So I appreciate that. We can go to the chat or to the Q&A. I'll go back and forth to see if there are questions. Okay, so I am not seeing anyone ask any questions.
Dr. Ghadir, is there any other information that you would like to share while we wait to see if any questions come in?
I did want to kind of emphasize that we do have in-house our own division that's called third party. We have multiple third party coordinators and also a third party concierge that helps people actually find their egg donors, also finds people their surrogates, and helps them through this entire process. They are also able to help as well and find donor sperm for couples as well. I do see a question that popped up, and it says, the age of the male sperm donor, is there a limit? So there is actually no limit, but when picking a sperm donor, there have been studies that have shown that sperm under the age of 40 has a lower chance of having congenital anomalies, aneuploidy chromosomal abnormalities, and there's even some small links that have been connected to potentially Down syndrome and also autism as well. So those are really important things. So the younger the sperm, the better. What I encourage all of my gay couples that have come to me in the past and may not be ready to proceed is, since you know you are going to be using an egg donor and a surrogate in the future anyways, why not freeze your sperm earlier and let it sit there? I have the world's record for the oldest sperm that was ever used to create a baby. It was 31 and a half years, and we had 3 babies born from that sperm. So it can really be helpful to do so, and freezing the sperm earlier could be fantastic. I think there were some more questions coming here under the Q&A. Can you talk a little bit about your Santa Barbara site? Absolutely. So our Santa Barbara site, I'm located in the office in Beverly Hills. Our Santa Barbara office has a complete IVF lab that is run by one of our own, actually a couple of our own embryologists that were trained here in the Beverly Hills office. We have a full-time staff there. The office is open 7 days a week as needed. However, they do not have a full-time third-party division there. So if anyone is going to be using a surrogate, a sperm donor, actually not the sperm donor, because we can definitely do the artificial inseminations there, but using a surrogate or a donor egg, we would recommend them to talk to our third-party department here in the Beverly Hills office, but all kinds of monitoring could be done in our office in Santa Barbara. The next question that I see here is, it says, if MET or MET is done, are there more? Okay, so I'm assuming MET is multiple embryo transfer. Is there more chance that they'll be splitting and selective reduction is needed? What is the process for that? Okay, so this is, I want to kind of rephrase this question so everyone can understand. The question is asking, if you put more embryos in, is there a higher chance for the embryo splitting? The answer is no. Every embryo that you put back, there's a 1% chance of a spontaneous split into 2 embryos. However, I want to be very clear, okay, that if you are not looking to have twins, I highly recommend not to put more than 1 embryo back. If your goal is to try to go for twins, we will put up to 2 embryos back. However, we will not be putting more than 2 embryos back in anyone. Our statistics and rates of success have hit a certain level that no longer does someone need to put multiple embryos just to pray to be pregnant. The other question here is also, at part of that is, what is the process of that DNA testing for each one to decide? And what I'm assuming that is asking is, we will do pre-implantation genetic testing done on an embryo. Most of our couples have put different genders in, so you know which gender is coming from which father's sperm or which father's embryo. But if you decide to put 2 of the same gender back in and both take, you will not know until you do DNA testing on your child which one is from which father. It says here, a next question, are there any risks with blastocyst biopsy? So a blastocyst is a full-grown embryo that grows to day 5, 6, or 7. And when done under professional trained hands, the risks are very, very low, okay? I do have twins myself. I have 4 kids. The first 2 were not from IVF. The middle 2 are from IVF. And one of the most important things for me to do by accomplishing the need to go to IVF at that time after a miscarriage did not allow us to have any more kids for a couple of years was the genetic testing, because I wanted to make sure that the embryos that go back are going to be the healthiest possible. The blastocyst biopsy done in my office is done by trained individuals that really know what they're doing. And I don't believe that the biopsy damages the embryo because it's done so carefully under such a specific technique that keeps the embryos from being damaged. Now, if done under untrained capabilities of people that are not so good doing the biopsy, 100% it can damage the embryo and it could fall apart and ruin the embryo. There are also some risks involved with the entire process of biopsy that I'm not sure how accurate they are. The studies are old. There are some imprinting disorders that people have discussed over the years, and we're more than happy to talk on a more individual basis if we think that there are true risks for you as a couple moving forward with this. The next question I'm seeing here says, what should you do to prepare your body before IUI or IVF prior to injections? I think being as healthy as you can be, taking supplements such as prenatal vitamins, DHA omega-3, coenzyme Q10 in the pure form called ubiquinol are very helpful for women. There are supplements that we give to men as well, but we usually save those for men that don't have perfect sperm and we need to improve upon. So not just for anyone, but those are, again, questions and things that we would talk to you during your consultation about. And then it says, what are your thoughts about intracervical insemination as a first step? So intracervical insemination means just injecting the sperm in the back of the vagina and onto the cervix and letting it do its own thing. No physician that I know does an intracervical insemination, but if you're talking about doing a home intracervical insemination, I don't recommend it at all. I think that it is much better when the insemination is done into the right location, into the uterus, up as high as you can get close to the egg, and trying to get the sperm as close to the egg with the highest chance of success. And also, more importantly, because I want to make sure that the sperm that is being used to make your future child is genetically tested and doesn't carry any of the same genetic disorders as yourself, is STD checked, and is FDA cleared to protect yourself from any kind of infection or abnormality or anything else that could occur during that process. And is a lot more complicated than just putting sperm in. And that's what some people kind of sometimes, unfortunately, don't remember. I hope that I was answering these questions well. And I'm going to go back and see if there were anything else. I did see a bunch of questions, and I think we've gone through them all. If anyone else has any other questions, I'm more than happy to go ahead and answer it. I did want to let everyone know, for listening to our webinar today, you will be getting an email that is going to have a code in it that qualifies you to get a special discount code for your consultation. And then you are able to set up your consultation with anyone that you want. If you guys are interested, I also wanted to give you a little heads up that I do have an Instagram page, which is called Dr.Shahin Ghadir. It is a verified page, and please don't follow the ones that are not, because unfortunately there's a couple other out there that are not mine. But we do have the Instagram page up for both myself and also SCRC has their own, the clinic has one as well. I do have a podcast called The Fertile Life that could be very educational, and a YouTube channel, both for our clinic and for myself, that put a lot of information out there for everyone to be watching as well. Later this week on my Instagram page, there is going to be a panel that comes out. It was a panel that I did with 4 gay dads that went through the entire process and were very open about their process and very educational. And I hope that's going to be very helpful. If anyone has any more questions, I'm more than happy to answer. If not, I wanted to thank every single person for listening and having a wonderful Pride Month and letting us know if we can be of any additional services or any additional help to you guys. So thank you again for listening. I think maybe one more question popped up. Is the seminar recording available for download? I do not, someone from my team is actually answering that question because I am not sure what the answer is. I know that we usually upload them to our YouTube channel and where it can be observed again. Don't know what happened to the answer of that. I thought someone was typing. I can almost promise you that it's going to go on to the YouTube channel, but I don't know if it's going to be downloadable. I'm not sure how that works. I'm sorry, I can't answer that one better.
Yes, it will be available on our SCRC YouTube channel about a week from this date. So thank you for that question.
Thank you for jumping in there. Okay, so with that being said, thank you everybody. And we look forward to talking to you individually during your individual private consultations. Take care and have a wonderful evening.
Thank you, Dr. Ghadir.
Thank you. Bye-bye.